Medical experts are calling on Canada to join the global fight against Mpox to help stop the spread of the virus in Africa. For more, we're joined by Dr. Fahad Razak with St. Michael's Hospital. Dr. Razak, good afternoon. Thank you for joining us. So let's talk about this and the latest from the WHO.
Yeah, the recommendation is that we join the global effort to provide vaccines in this region. Clearly, there is an outbreak happening, which far exceeds anything that we've seen previously with this virus. Some worrying features of it is we're seeing an increasing number of children impacted by it, and mortality rate within children is going up from this. So this is an unusual change in the nature of the virus. It's very different than what was seen in 2022 when the last emergency was declared. And frankly, it is worrying. And Canada does have a role in helping suppress the spread of the virus in the region.
Dr. Razak, I was just going to ask you about that. What does Canada's role, or would Canada's role, look like?
Two things I think really to consider. The first is that we have a lot of expertise in disease spread, so allowing our experts to help provide advice. But importantly, advice alone is not enough. There is a desperate need for vaccines. So in this region, the estimate from the WHO is that they're short more than 10 million doses of the vaccine. This disease can be largely mitigated and spread can be largely reduced through the vaccine and behavior change. So getting the vaccine out there is really important. Canada has not really committed to being a significant actor in providing vaccines there, and I think there's a lot we could do.
And Dr. Razak, along those lines, in terms of vaccines and proper vaccinations, this is, it's mutating even more than it was when it was first seen. Can you talk about that?
Yeah, this disease has been around for decades. We thought we had a sense of how it spread, and then there was that outbreak in 2022, and the amount of spread far exceeded what we expected. What's really worrying now is this newest outbreak, the one that's occurring in 2024, is even more aggressive. It's an additional new variant that we haven't seen before that is spreading rapidly, spreading among groups that are traditionally not affected. As I said, a lot of kids being affected. The majority of new infections are among kids under the age of 15. Otherwise healthy, and a number of those children are dying, more than 500 deaths among children under the age of 15. This is worrying because the degree of change that's occurred and the rapidity of the spread indicates that the virus may have further potential to accelerate into other populations. We did not expect this to occur, and that's why you have to keep a close eye on it.
So along those lines also, Dr. Razak, can you talk about the transmission of this? I mean, we are even more connected globally now than ever before.
Yeah, look, Canada needs to care about these things. We are one of the most widely traveled regions of the entire world. We have a highly diverse population, an incredible hub for flights coming in and out to the country. So we're the kind of country where diseases like this tend to occur more than other areas which are more isolated. So we do need to keep an eye on this. I want to emphasize this is nowhere like the risk we saw with COVID in the last few years. Importantly, although it is possible for this disease to spread through the air or through droplets, it is largely spread through direct contact, so either skin-to-skin contact or through contaminated items like clothing. So that is why you're seeing this cluster and direct spread occurring in Africa right now. So I think we need to care about it. There are roughly 100 cases here that Toronto Public Health is keeping track of, which is much more than last year, but we have not yet seen the new form of this, which is the new clade of disease that's occurring in Africa. We have not seen a case yet here in Canada. That's a good thing, but we have to be vigilant.
Okay, Dr. Fahad Razak with St. Michael's Hospital, thank you very much for your time.
Nice to see you.